Hi, I am Dr. Robbie George. I am the Chief of Vascular Surgery at the Narayana Health City in Bangalore. I'm just going to touch upon some of the modern advances in management of blocked blood circulation. So, blocked blood circulation can cause various problems, including severe pain when it happens suddenly. It can lead you to have difficulties in walking. It can lead to problems like a stroke. It can lead to wounds that do not heal, and all of those can happen. So if you have blocked blood vessels, we normally would want to open them up and restore blood circulation if that is appropriate for you, and that's a clinical assessment. Now, traditionally, the ways to do this have been two. One is by open surgery, where either you clear the blockage or you do a bypass, that is, you get flow going from above the block to going below the block. Or you do this by an angioplasty, where you stretch open the block and restore flow, and you may support this with a stent. Now, all of these techniques have really revolutionized how patients were managed, but technology has moved forward and we are able to do more things than we could do earlier. So earlier, the treatment, if you did it by to do a balloon and use a stent. Today, we have specialized stents that can deal with the stresses of constant bending and blocking. So that's something that helps the stents to stay open for much longer. A lot of patients have very, very hardened blood vessels, which are like rocks, which do not respond well to just an angioplasty with a balloon. So in them, we use something that is called shockwave lithotripsy, which is similar to what you use to fracture stones in the kidneys. And this helps us to really soften up the hardened blood vessel and preserve flow. There is another technique which is called atherectomy, where in selected patients, you would use some method to remove the blockage, which can be either by laser or what's called orbitable or directional atherectomy. There are various techniques for doing this. There are patients where the blockage happens due to a clot, and we can do simple things like sucking the clot out with specialized equipment, or you can use clot busting medicines to dissolve it. So all of these options exist, and all of these options have a place for them to be used appropriately. And these are options that can make restoration of blood flow less invasive and less traumatic for the patient. And these are things that we as surgeons would consider if ever you have to treat someone with a blocked blood circulation. Thank you.